Hello. Today we will be discussing how about the ways to diagnose diabetes. There are various methods to diagnose diabetes. One is fasting, other is postprandial, and the third one is HbA1c. Diabetes is a condition in which the body is unable to utilize the available glucose due to defect in the insulin production, or maybe its utilization at various stages. And uh, first, when we go for fasting, the patient should not eat anything for last 8 to 10 hours. This is the basic thing. Then postprandial diabetes, fasting diabetes, blood sugar, withdraw venous blood, and postprandial diabetes, the patient should go for the test 2 hours after a normal breakfast. Okay, and the third one is HbA1c. The For HbA1c, there is no need. There is no such restriction whether the patient should withdraw the blood in fasting or after meal. They can opt for anytime they can withdraw the blood and get themselves tested. The fasting level should be less than 110 milligram per dl, and postprandial it should be less than 140 milligram per dl, and HbA1c, according to the Indian guidelines which we follow, it should be less than 6.4 or 6.5. Okay, if anyone is diagnosed for this type 1 diabetes, actually type 1 diabetes is basically found in younger generation, like in children, in adolescent, and type 2 diabetes, it develops later, at the later part of the life. So most commonly we found type 2 diabetes because it is the most prevalent form of diabetes. So most commonly we found type 2 diabetes, and type 2 diabetes develops the development of symptoms in type 2 diabetes takes longer course. So most of the time, when we diagnose the diabetes, the complication is there, or some of the other macro symptoms are there. But in type 1 diabetes, the detection is quite earlier. Patient usually presents with symptoms, but in type 2 diabetes, the symptoms are usually not there, or if the symptom is there, it's not so much. Okay, and the other type is gestational diabetes, which is present during post pregnancy. In this gestational diabetes may go off after the delivery, or it may persist for the rest of the life